Now this is again a very unnecessary question, I would say, but it's there and therefore I have to put this. Medullary carcinoma thyroid is part of men, all except men 1, correct? Now what they have asked is
Bilectic surgery in 1 year or 5 years.
excellent. See, some concept based things. So the most virulent is men 2A, 2B. Now this is a conceptual one, so this should not go wrong. So an upper motor neuron includes, we normally say UMN palsy. When we normally say UMN palsy, we normally, answer is A. And this should not be wrong in anyone, because we talk about, every time clinical examination, whatever, clasp knife and cog wheel. So whether it is clasp knife spasticity or it's cog wheel rigidity, it is both ways a spastic condition. What is important is that, if you look at the extrapyramidal tract, the other things are not really there, which are similar to lower motor neuron, although extrapyramidal is an upper motor neuron condition. But what we know is, so you could have still guessed the correct answer, because you know that it's going to have an increased tone. Distribution of weakness in pyramidal tract lesions. What is the posture that somebody with an upper motor neuron palsy normally adopts? Or that you read about comparison between an upper motor neuron and lower motor neuron, and this should have these differences. Everything is detailed, and how you can remember is it primarily by the posture that a person with an upper motor neuron palsy assumes. Hirano bodies. So Alzheimer's disease, it's Hirano bodies. We know Pick's bodies, we know Levy bodies, we know Hirano bodies. Lafora bodies has also been asked, which is a type of progressive myoclonic epilepsy. It's Lafora's disease. And these are some of the questions that seem to be A. The answer is correct, but why not B? So it's iron accumulation with neurodegeneration. If you're sitting in the exam, would you be confused between A and B? I don't know. The answer is correct. But as mentioned, typical hemochromatosis patients do not accumulate excessive iron in the basal ganglia and do not develop movement disorders, cognitive disability, or dementia. It's easy to get it wrong, in my opinion, primarily because it talks about excessive accumulation of iron. But it seems to be one of those questions that has been repeated more than once, probably because people tend to get it wrong. What else? What other signs in A?
Mickey Mouse sign.
So you got the hummingbird sign, and this question has been asked in two ways. What produces the hummingbird sign or the penguin sign? Yeah? Midbrain with preservation of the pons. So This has been asked separately. Which of the conditions will show atrophy of the midbrain with preservation of pons? And what is the other sign you see on PSP?
Mickey Mouse sign.
So the Mickey Mouse sign or the morning glory sign, again asked. Valley sign. Correct. So the answer is Duchenne's, and this is primarily also known as the Pradhan sign. Was described as a new sign in Duchenne's muscular dystrophy by an Indian neurologist. Probably that is why it becomes important. And it's basically a valley that is formed between the hypertrophic deltoid and the, what is it, infraspinatus. So that's the valley sign that has been shown here. So again, a question that has been asked more than once in the recent exams. This is multiple times again in dermatomyositis, and you need to know all the signs that are. So there are few signs that have been asked multiple number of times. The signs, all the signs in dermatomyositis and all the signs in Sturge-Weber syndrome. They seem to come in every paper of MBE. And they come as a picture thing also. So what is a holster?
Used to keep gun.
A holster is primarily a bag that you hang around, and or you know, a holster bag could be for anything, including a gun. It's in the distribution of this thing. So now I have come to the end of the presentation. There are few questions left. Platelets in blood bank is, they put as 1 day, 3 days, 5 days, 7 days. Half-life of transfused platelets in healthy adults is, and they put as 12 hours, 24 hours, 3 days, 5 days. So it's being asked multiple number of times in different kinds of questions, maybe different sessions, different kind of questions, but it is, so the answer is, the half-life is 3 to 5 days. And once the bag is opened, it needs to be administered within 4 hours. Storage time is 5 days. For in certain conditions, it can be extended to 7 days. And the temperature for storage is 20 to 24, is room temperature. And which is not mentioned in this is that they do carry the RH antigen. So these three questions that I've written down have been asked the way they are. It's 14 at birth. And then you've got this chart, which is the WHO definition of anemia, where they've given in, you know, children aged 6 months to 6 years, 6 years to 14 years, adult males, adult females, non-pregnant, adult females pregnant. Probably one of those things which you will have to remember is because it's been asked recently more than once again, but it varies, so it's not going to be easy to remember it though. Anuria
100.
less than 100 ml. What if the question says no output of urine? If it says no output of urine, no output of urine, that's surgical anuria. Microscopic hematuria, 3 or more. Trace element in dialysis patients associated with osteomalacia. The answer is aluminium. And you've got aluminium in patients on long-term dialysis has been associated with anemia, osteomalacia and encephalopathy, these three conditions. Dialysis disequilibrium occurs due to, the answer is reverse urea effect. It is not confirmed, meaning there isn't this is the most likely reason believed to be that accounts for dialysis disequilibrium. Basket weave appearance, L-ports. Lot of questions on L-ports, including a lot of ophthalmic questions on L-ports. Pancreatic endocrine tumor associated with migratory necrolytic erythema.
Glucagonoma.
Glucagonoma. Again, this is very characteristic of glucogonomas seen in 67 to 90% of cases. And I've given all the rest of the details. Now, what about this one? Alpha-1 antitrypsin deficiency, we normally talk about emphysema, we talk about lung disease, liver disease, also alpha-1 antitrypsin deficiency. What becomes important is if the question asks you alpha-1 antitrypsin, spend time, but something that you really need to know is these defects. So you need to know about Barters, you need to know about Gentleman, you need to know about Loeys, and you need to know about Dents. These four conditions are repeatedly asked. These are tubular reabsorption disorders. You will have to go through them, make a very short and concise note for you to remember which one suits into what. But it's been asked multiple times.